The development of aldehyde for MPS I was life-changing for our families of children with Hurler-Scheie, and Scheie. However, it's not enough. It requires recurrent enzyme replacement every week. And we've done the same for MPS II, 4A, 6, and 7. These children and adults are seeing response to their therapy, but requires weekly or every other week therapy for the rest of their lives. So the next area of research is looking for therapies where we can correct the underlying enzyme defect permanently. And some people might think of gene therapy as a cure. Cure is a very difficult term. The disease that's still that's the disease burden that exists may not be completely reversible, even if we replace the gene back, the missing or defective gene. But it would help to alleviate that need for every week or every 2-week enzyme infusions and start to mimic the natural environment of having enzyme expression throughout the day, every day, to help reduce the glycosaminoglycan deposition. And that's on the horizon for all of the MPS disorders. As we see with MPS I, bone marrow transplant is an approved or is a therapy that's recommended for children under the age 2 to help correct that underlying enzyme defect, but there's a lot of morbidity and mortality associated with. So, and the other ones are still just relying on intravenous therapy that's FDA approved. There are certain experimental trials looking at intrathecal delivery of enzyme that's in development or in trial right now, but it still requires recurrent infusions. And so the idea is to make a safe delivery of the gene through viral vectors and have a one-time infusion, thereby correcting that underlying enzyme defect with enough expression throughout the child or adult's life so that they can continuously treat the disease.